Hello, this is John Terr. I am President and CEO of the Boulder Chamber, and I welcome you to one of our series on industry-specific feedback sessions for our preparation for the reopening of businesses during this COVID-19 safer at home period. I want to start by, first of all, thanking all of you who have joined us today for this discussion. It's going to be so important to get your feedback on the regulations and the guidance that we get from our public health authorities. I also want to make sure to thank all of our Boulder County chambers and economic development authorities for participating with us in bringing together this event and this feedback session, as well as the upcoming education sessions. It is a partnership. We've all been working together to make sure that we help our businesses through this period and support our local economies. And then finally, I want to make sure to thank our Boulder County Public Health authorities. They've been working very hard to address the public health issues associated with COVID-19, but they've also heard us in our direct appeal to make sure that we get our businesses operating as soon as possible, but at the same time recognizing that we want to do it in a manner that's safe for our business owners, the workforce, and our customers. Before we get started, I just want to talk about just some key points to consider as we go through the presentation. First of all, many of the regulations that our public health authorities are going to outline for us today are coming directly down from Colorado Department of Public Health and Environment. And it is not in our purview to address those in terms of pushing back. Those are mandates from the state. We also will be hearing of regulations that Boulder County Public Health feel are critical for us to implement in order to protect public health. Certainly, if you recognize gaps, if you have feedback for them, they are going to want to hear that. But we also recognize that they are the folks that we are relying on to help us understand the public health opportunities and protection opportunities here. But throughout this, we want to engage in a dialogue around strategies for how we can best implement these public health operations in the manufacturing area that is the focus of this session. So without further ado, I'm going to pass it off to Zach Swank, who has been working with us as the business liaison and the Boulder County events person for this COVID-19 period. It's been a great partnership, and he will walk us through the presentation on the specific needs for our manufacturing community. So Zach, thank you so much for putting this together with us, and we look forward to a robust conversation.
Thank you, John, and thank you to the Boulder Chamber, as well as all of the other chambers across Boulder County and our economic partners. Alexander, if you just want to go to the next slide. I encourage everybody today to include your questions in the Q&A section of this. And we're going to spend a little time touching on the current status and timelines for businesses, an overview of our forthcoming compliance checklist for manufacturers, as well as a discussion of any industry-specific challenges and solutions that you all face and have. And mostly, we want to reserve the latter half of the hour for an opportunity to ask questions and give feedback. So this webinar is focused on manufacturing, obviously. Critical manufacturing has been able to be open throughout this time, and non-critical manufacturing is able to be open starting May 9th under the same requirements as critical manufacturing under the Safer at Home order. So critical manufacturing, folks on this call are likely familiar with these industries. You know it if you are. I won't go through the list here. So we'll go on to the next slide. But we want to take a moment to touch on and recognize the feedback we've heard from the business community directly and from our chamber partners who have been such a good voice for businesses throughout this process. First, everyone is concerned about safety, all around, and it's really been great throughout this pandemic to see, how proactive and with what great concern everyone is acting. Also, we understand that businesses want a seat at the table in terms of crafting guidance and regulation. We understand that your business is best. Certainly for manufacturing, each business varies greatly from one to the next. And so, you understand the conditions within your facility like no other. We also know that you're looking for clarity. Vague regulations are tough to follow and hard to understand, and that's something that we're hoping to address with the checklist that we are producing. Also, we understand that blanket policies don't work for everyone, right? Particularly with the variability within the manufacturing industry. Having a blanket statement that every type of manufacturer is going to comply in a certain way is problematic. We also understand that folks are looking for a longer outline in terms of both process and events. What is coming next, and when will the orders or guidance change. We also know that everyone is having difficulty procuring masks, and that there's a need to build public confidence in the safety measures that businesses are putting in place. So a simplified timeline here, there have been a lot of orders that have gone into place. These are the basics. So we've been under the state stay-at-home order from late March, and then Boulder County extended that order by 2 weeks with the change of also allowing curbside for retail. And then starting on May 9th, we anticipate to be under the state's safer at-home order. So again, we're right now, same conditions as we've been for the last 5 weeks. That remains true until May 9th, with the exception of curbside retail. But then, now is a great time to start preparing our businesses and employees for the safer at home order. But I want to emphasize and reiterate that this is a long-term haul here. I think it's human nature to expect things to revert back to the way they were whenever we're in a state of change. But it's going to be months that we will be under some version of something like a safer at home order, really until we have a vaccine, effective treatment, or herd immunity. We will all need to continue to adopt the practices to keep ourselves safe. And one of those, really gets back to, both the name of both the safe stay-at-home order and the safer at-home order, which is, really as much as we can, stay at home except for necessary and essential activities. Wash your hands, wear a face covering, all of those basics. We cannot give up on those practices, and nor are we allowed to, because they're spelled out in the order. So what is safer at home? I jumped ahead of myself here on slides here. Continuing to stay home as much as possible, with some changes for retail, field services, personal services, limited healthcare settings, offices coming back to 50% workforce, as well as non-critical manufacturing being allowed. And now I'm going to pass it over to my colleague, Alexander Phillips, who is on the business and events liaison team and is the specialist focusing on manufacturing.
Thanks, Zach. So there's 3 sections for the manufacturers, employers, employees, and customers, if that fits for your manufacturing. Some may have some customers, but for the employers, deputize a workplace coordinator is a good thing, someone who can keep track of things and help facilitate and educate. Maintain the 6-foot distancing. Everyone's been hearing that everywhere, very important. Frequently sanitize areas, especially the high touch areas, clean everything regularly. Posting signs helps to educate and remind people. Ensuring proper ventilation, really important during this time, more so than ever. Avoid gatherings, and gatherings could be a meeting, even in break rooms, try to keep that to a minimum, possibly even not having break rooms open, and also if there are customers that come in. And then workplace monitoring the temperatures of people, and if they're sick, having them go home. I already said about eliminating or sanitizing the break rooms and stuff. Of course, wearing gloves and masks, you'll keep hearing that again and again. For the employees, if they show any symptoms, they need to go home. Another thing is if employees are taking care of someone who is in a vulnerable population, they would still be under the stay-at-home order and wouldn't need to come in if they are a caregiver of someone who is in a vulnerable population. And then if there is an ability to do remote work, remote scheduling, anything to keep the number of people in the office or manufacturing area down. Of course, minimize all in-person meetings. And even at those meetings, if there is a need to have a meeting to maintain the 6-foot distancing. And then encouraging breaks, taking breaks. A lot of this is the same for the employers and the employees. And then hold on one second. Yes. And then there's the compliance checklist that where it's mandatory to go by these orders. Use of the checklist that we've been talking about is voluntary, but it can be helpful to keep track of what you need to be doing and even show others what you're doing, either your employees, customers, whoever. There is going to be a poster that's coming out probably later this week, I think. That will also help. And then the enforcement. Enforcement is on a voluntary basis. We're getting, I'm sorry to say that exactly that way. Let me rephrase that. Enforcement is mandatory, but we're waiting. There's the line, we're waiting for complaints. It's complaint driven. The most important thing is that we're trying to educate, and of course we're all on a huge learning curve and doing the best we can to educate you, and you're all doing the best you can to do what we can to be safe. So thank you for that. Thank you for looking at what needs to be done. Oh, and here's the checklist slide. The 6 feet apart, frequent cleaning, proper ventilation, flex the schedules. As I said, or as Zach said, I think, the checklist will be coming out later this week, probably tomorrow. I think the checklist will be available for manufacturing tomorrow. Oh, sorry, out of order. So here's the customer checklist. And as I said, the customer checklist may or may not be relevant to your particular manufacturing business, but I thought I would keep this in here just in case you do get any customers. One thing that is happening is that people are creating special hours for people at higher risk of COVID. Of course, the 6-foot distancing. It says here, encourage use of gloves and masks. That was written last night before the City of Boulder mask requirement went into place. Providing hand sanitizer, if you have it, is really good thing to do. Installing shields or barriers, and a contactless payment if possible. So that's if you have the customers. So here's where we get to hearing from you. What feedback do you have about the checklist? Is it helpful? challenges of your particular industry. Manufacturing can be a pretty diverse industry. Is there also a value in the weekly industry work groups? Any modifications, other gaps? As I said, manufacturing can be pretty diverse. Is there something that you feel that isn't fitting your particular industry or you want more guidance on? We'll do our best. What else is needed on the checklist?
And so I just want to jump in, Alexandra, and share that the checklist we're mentioning will be shared out with all of the attendees of the webinar when it's made available. And we've put it into a Google Docs form that you can comment on directly. So, when that's out, please feel free to make suggestions and additions to that checklist. Again, your business is best, and we're really looking for your feedback here. Also, just a plug for any questions that anyone have now, please do use the Q&A option of the webinar and go ahead and submit your questions so we can get back to you about those.
Mm-hmm. Thanks, Zach. Yeah, if you can put in the questions, that's great because it helps us understand how it looks on your side, what questions you have. Is there a value, more questions for you, is there a value to a weekly COVID compliance work group? What topics? What presenters should be invited that you need to hear from? And also, if you have additional questions after this webinar, and as Zach said, you can be putting in your questions right now. There's the call center. There's the phone number, open 8 to 6. There's also the email, COVID violations, notice that S, COVID violations at bouldercounty.org. And don't think of it, I know the email is COVID violations, but think of it more as just a resource you can send in if there is a violation, but send in questions, comments. That is all those emails are being looked at. So we really need to hear from you too, so we can get out the better and more information. The next session for the manufacturing piece is Tuesday, May 5th, 10 to 11 a.m. There is a link to register. The best way, you can click on this if it's available later. It will be posted later. And then the easiest, quickest way to do it is just going to the Boulder Chamber website, which is laid out really nicely, easy to find everything. And you can just register on the Boulder Chamber website. Where to go for information, bouldercounty.org is a good one. And of course, the Chamber of Commerce, lots of other places. All of us that are working on the COVID response are going to the covid19.colorado.gov probably 10 times a day. There's a lot of information there, nicely laid out. That's a great source. So that's the last of my slides. Zach, I'm sorry.
Great, this is Corinne Waldo. I'm with the Boulder Chamber. I'll be asking some questions out of the Q&A feature. If you have questions, please continue to put those in. If they're easy ones we can type answers to, Zach and I and some others can do that. Otherwise, I'm going to ask our panelists. We have a question about temperature checks. Specifically, one person said it seems like there's a de-emphasis in this, and I know they haven't seen the actual checklist, but maybe talk a little bit more about temperature checks. And then there's a follow-up question to that.
Yeah, so for temperature checks, whatever is in the order applies. And like I said, we're still working on the checklist for manufacturing, which is based off of the order and then includes some additional best practices. So stay tuned for that to come out. but there will be no difference between what's in the order and what's in the checklist. The checklist is really just a compliance tool to help you easily digest the order.
Okay.
And then the question on Bill, if you want to jump in on this one, I see temperature checking at the entrance sounds straightforward, but based on experience is challenging, especially when a person being checked with an infrared scanner immediately upon entry. Outdoor temperature affects reading significantly. And then an offer from Lexmark to share learning and experience.
Yeah, hi, this is Bill Hayes. During normal times, I'm the air quality coordinator for Boulder County Public Health. During this COVID response, I'm serving as our safety officer. I've gotten a lot of similar questions with the infrared or no-touch thermometers. Whoever posted that question is exactly right. There are a lot of things that can influence the accuracy of that reading. And so if you are doing temperature checks of employees, maybe you want to have something where, let them come in, go directly to their workstation, avoid contact with others, and in a half hour do that temperature check once they've, adjusted to away from any outside environmental influences on that temperature. But what I always come back to with those temperatures, we're not looking to find out if they are 98.6 exactly. We're looking for elevated levels. And an elevated level is considered to be anything over 100.3. And so, while there can be some environmental influences that can fluctuate, plus or minus a degree or two, we're really looking for, are they elevated, not is it a normal temperature? And so if you do get a reading on someone that is slightly elevated, but not over the 100.3, you might want to recheck them again in a half hour.
Great. To follow up on that, we have one more question about, can an employer safely depend on self-administered temp checks and symptom checklists?
I've seen it done both ways. And the difficulty with doing a self-administered temperature check is it's kind of hard to know when you're pointing it at yourself. Are you hitting the center of your forehead? Additionally, if you're having people self-check, they need to be wiping down that thermometer with a disinfectant wipe after each use, and then the next person should wipe it down before they use it and again after. So, if you have the bandwidth to have one person designated as taking the temperature, I think that's a far better way to go. But I understand that, that does then take a dedicated resource.
Okay, here's a question. It's our office is fairly split. We have a vast majority that are taking the recommendations very seriously, and a small minority that think recommendations are way too strict and think the business should continue as usual. Do you have recommendations as to how to handle the smaller group that's more resistant to following recommendations? And is there anything in the public health order?
Yeah, that's a tough one for sure. The approach that we've been taking throughout this process is education first. There's a lot of information that we all need to digest about, what COVID is, how serious it is, what the impacts are, what our responsibilities are, and also why our responsibilities are important. So, I would encourage an education first approach to employees who are resistant. If that does not work, as an employer, you have all of your usual authorities that are available to you to manage your employees, as appropriate. Also, the order itself spells out some pretty clear requirements in certain circumstances that are compulsory. And so, if you feel like you need backing, then, pulling up the order and referencing, what it spells out as mandatory could be another solution.
Okay. Our next question is actually from Tom Bugnitz with Manufacturer's Edge. He makes a comment that we're recommending manufacturers keep logs and contact info for all visitors to manufacturing facilities, and keeping logs of all meetings and attendees for purposes of mini contact tracing if someone in the facility tests positive. Have you given any thought to that kind of tracing?
Yeah, that's a great recommendation. It is required for close contact personal services. It is not currently a requirement for manufacturing, but it certainly would be a best practice. And I just want to talk a little bit about why that's important. So as we move into the safer at home order, you know, the degree to which COVID-19 is contagious is not changing. We're just changing how we're handling our response to it. And that change really relies on more testing, and then the testing alone is helpful, it's informative, but the thing that keeps us from having a rapid spread of the disease is the contact tracing and isolation. So anyone who tests positive, our team of epidemiologists will follow up with them and follow up with everyone that they've had contact with in the relevant time period since they've likely been carrying the virus. And then those people will, as appropriate, could be given notices to quarantine or isolate. And so by keeping those logs, you're really greatly facilitating that process. So if you have a visitor who comes in and we later find out that that person tested positive for COVID, or if you have an employee who had interactions with the visitors, that information is tremendously helpful to limiting the spread of disease.
Okay, we're going to go back to one more about temperature check from Don from Lexmark again. He writes that people are tested immediately upon arrival with the IR device. They do regularly come in with initial readings that are greater than 100.4, 100.3 when it's warm outside. Upon recheck a few minutes later, they are fine. We don't allow people to go to their workstation without passing, so it causes some churn in the process. Any suggestions?
Yeah, I think that's going to be, back to where Zach started. Every manufacturer, every facility is unique. I would say it would be great if you had essentially a isolation area that, if they come in, they test high, you can immediately move them to essentially a waiting area to retest them in 15 minutes or so later. I'm not sure that many folks would have that luxury of that kind of space. And I'm sorry I can't give, any better guidance than that, but I think that's something we'll need to look into a little bit more. And maybe what we're going to realize is that temperature checks in this fashion maybe aren't practical, but we'll need to look at that and try to see if we can come up with some better recommendations for you.
Okay. This question came up on a previous webinar as well. Do we have a list of vendors we can use to find out how to purchase thermometers, plexiglass, masks, gloves, and other products? We have a lot of those questions coming in.
Yeah, that is a challenge. That's a challenge for everybody. We are working on providing a list, which I expect to have out next week. However, I would encourage everyone to keep searching and keep looking. Even when we have our list out, now we're going to have a list of folks that we've had success with, but directing a lot more businesses to those vendors, so they are also going to be overwhelmed. This problem is probably going to get worse before it gets better, as counties in Colorado and in other states start to open up, and the demand for these products, which already outstrips supply, continues to grow. Unfortunately, there's not yet a great solution to this, and it's a challenge that we're working on. So I encourage everyone to keep searching, keep looking. We will do our best to share resources with you as we know that they're available. But this is a frustrating one for sure, and it's going to remain that way for some time.
Yeah, and I would add to that you know, no surprise to any of us, there's a lot of unscrupulous actors out there trying to make a buck in this arena. So if you get an email from someone with an offer that sounds too good to be true, it most likely is. So I would recommend sticking with established supply chains that you've used in the past. And when you are looking to purchase things like thermometers and masks, look for FDA certifications or other certifications on those items to ensure that, you know, you're getting a quality product.
The other thing I'm going to mention is that, and I've mentioned on other calls, Todd Bugnitz from Manufacturers Edge also reminded me that they're working on a statewide marketplace specifically for small manufacturers to be able to purchase. And that will be coming out in the next week or two, and we'll be sending those resources directly to businesses as well. Okay, so another question. Does Boulder County have a response plan for what the county will do if a facility has someone who tests positive? Are we requiring closing down specific sanitation steps?
So early on, I was looking to my epidemiologist colleagues for a single guiding document that we could put out that, you know, has all the information and was going to be clear and universal for everybody. But it is just too situational dependent. So, you know, we are here to assist on a case-by-case basis. Something I do want to share is that under the Colorado orders, any facility with 2 confirmed cases is defined as an outbreak, and that requires certain reporting. You know, our epidemiologist team gets notified when residents in the county test positive, and then we'll follow up with their employers. However, we all know well that you know, many folks who work in Boulder County don't live in Boulder County. So if you are a company that you know, has a employee that you know is tested positive, please do reach out to us and share, because we should be getting that information from their home resident county. But you know, it's important for us to act quickly, and so sharing that information helps us do that. And then we will then follow up with a customized plan based on your facility. You know, I mentioned earlier, you know, wanting to avoid blanket policies. You know, it would be simple to say, you know, hey, if you got 2 employees that test positive, you know, your business needs to shut down for a week, right? That's clear, it's simple, it's universal, but also not very practical and not very fair. So we really want to be customized to each unique individual situation. So reach out and we will let you know what is best for whatever the conditions are.
Okay, another question, and we've gotten these on other webinars. Are there specific requirements or standards for accommodating a high-risk employee or an employee with an at-risk family member?
Yeah. So the Safer at Home order specifically spells out vulnerable individuals who are either over 65 years older, have chronic lung disease or moderate to severe asthma, individuals who have serious heart conditions, individuals who are immunocompromised, pregnant women, and individuals determined to be high risk by a licensed healthcare provider. So any of those individuals under the Safer at Home order cannot be compelled to come work at the facility. You know, the business should make every accommodation to allow them to work remotely. What was the second part of that question, Corinne?
If they have an at-risk family member.
Yes, there are also allowances should be made for individuals who are caring for or living with an at-risk family member. And that is spelled out in the order.
All right, so some of the requirements, we got a comment that this may be difficult for particular organizations or their flexible work schedules, especially if they have shifts. What are some recommendations you may have in that situation, or should they reach out to you?
Yeah, that sounds pretty situational dependent. We're happy to if you have questions of your proposed plan, we're happy to review that. And as Alexandra said, our COVID violations.bouldercounty.org doesn't really sound like the right email address. I'm realizing now we're probably going to make a different one. But if you use that one, you will get to the folks on this call, and we will be happy to take a look at what your specific challenges are around shifts and provide recommendations.
Okay, here's a pretty specific one, but it might be some other people's questions as well. Our cells are designed in a quad of 4 machines, and it is very difficult to maintain the 6-foot distance. We're requiring masks for those employees and cleaning of machines between shifts, but wondering if you have any thoughts if we can't physically change our equipment.
Bill, you want to take this one?
Yeah, I think in that situation, we need to look more to engineering controls. Is there any way to put high partitions between the workers, establish airflow ventilation systems that's constantly moving that air away and fresh air replacement? For situations like this, it's tough to say, well, we should go to respirators and masks. If you don't already have a respiratory protection program in place, starting one up is a bit of a challenge. And anytime we're talking about putting respirators on employees, and that includes the N95 masks, you need to have a fit test program, and that involves a medical clearance for that individual, and then a fit test, and then only allowing those individuals to wear masks that they've passed fit tests for. So rather than go straight to the respiratory protection, we should always look at engineered controls first, and that is partitioning, airflow. Again, it's very situational, and again, as Zach has said, we're here to look at those individual situations.
All right, do we have any other questions, either in the chat or in question and answer? I just want to mention, and they're on the call as well, and Tom has given some questions already, but a good resource would also be your Manufacturing Association and Manufacturers Edge. They're helping to get some of the information that we send them from Boulder County as well out, but they're a good resource as far as some of the best practice. And again, continue to converse with Boulder County Public Health, particular situations. We get a lot of questions from manufacturers on this or that. So make sure you reach out to your health department to make sure that they can help you through those situations. All right, and then Janine from Manufacturers, you also want me to introduce her. Janine Lendingham, many of you know, she's the Regional Director for Manufacturers Edge in Boulder County. And she and I probably talk 3 or 4 times a week on questions, and we'll continue to filter those into Boulder County Public Health as well. All right, well, if we don't have any further questions, we want you to remind you that there will be an education session when we have the final checklist, when we're moving closer to the Safer at Home order. That is next Tuesday at 10 o'clock. We will be sending out an email following this session with answers to questions we may not have been able to answer, a recording of this video, as well as you'll get the checklist from Boulder County Public Health by being part of this program. We're also working on countywide documents that you can print out and put up, some of those resources that are mentioned in the Safer at Home orders. And we're working in collaboration with the different chambers and economic development and cities within Boulder County. We want to thank you for coming today, for asking your questions, but continue to do so. Continue to reach out and continue to figure out how we can safely reopen some businesses and continue to have public health and our economy front and center. So do not hesitate to reach out to anybody on this call, myself, we mentioned Manufacturer's Edge, and we appreciate you joining us today and being part of this. Thank you, and I hope you all have a wonderful day.
Thank you.